The menisci are two crescent-shaped wedges of tissue in the knee that act as shock absorbers between the femur and tibia. They provide a cushion between the bones as the knee straightens and bends, and they help create stability as the knee turns and rotates. The meniscus on the outside of the knee is called the lateral meniscus, the meniscus on the inside, the medial meniscus. Meniscus tears often come from a single acute injury, like a sudden twist during sports activity. Other tears can be degenerative, the result of wear and tear in a middle-aged or older individual. When a meniscus tears, it may cause pain, swelling, limited motion, or even locking of the knee. If you have symptoms of a meniscal tear, you should see your orthopedic surgeon. Your surgeon will examine your knee and look for signs such as joint line tenderness, decreased motion, pain with rotation of the knee, and clicking within the joint. If your orthopedic surgeon suspects a meniscus tear, he or she will order an MRI scan. An MRI can show a meniscus tear. In these pictures, a normal meniscus is on the left, a torn meniscus on the right. The tear is seen as a white line through the dark body of the meniscus. Non-operative treatment of a meniscal tear consists of bracing, modified activity, oral anti-inflammatory medication, steroid injections, or physical therapy. The surgical treatment is arthroscopy. The arthroscope, a small instrument connected to a light source and video camera, is inserted through a small puncture wound in the knee. Additional holes or portals are used to insert other instruments. Arthroscopy may reveal several different types of meniscal tear. A radial tear extending from the edge of the meniscus into the substance. A flap tear, where a flap of meniscus protrudes into the joint. A degenerative tear, where the edge and substance of the meniscus are fragmented and torn in several areas. A bucket handle tear, when the meniscus tears in its substance but remains attached in front and back. This type of tear frequently displaces and causes locking of the knee. Most often, the surgical procedure is arthroscopic partial meniscectomy, removal of the torn part of the meniscus. This is done with a combination of small instruments called punches and motorized instruments with suction called shavers. Here, a degenerative tear of the meniscus is smoothed down with a motorized shaver. And, in this segment, a bucket handle tear is probed with an instrument, detached with a punch, and removed from the joint. In some cases where the tear is near the joint capsule, the meniscus may be surgically repaired. This is done with sutures, as shown here, implants, or a combination of both. Meniscal repair may require a small open incision on the side of the joint. When surgery is complete, the portals